Back to Healthwise with Dr. Ben Sabagian. Doc, you was telling us about TIFs and you were going to explain some options on the board for us.
Sure. Well, with reflux, the reason people have been on proton pump inhibitors and antacids for so long is because the surgical options were somewhat limited. Nowadays, with reflux, you have, as far as options are concerned, you have what's called a Nissen fundoplication, which is basically a surgical procedure where you wrap the esophagus, we wrap the stomach around the esophagus, and you do this either with a laparoscope or an open technique. And this is what we've done traditionally for years and years. I've done this for many, many years. Now there's a new procedure out called a TIF procedure, which stands for transoral fundoplication. And essentially what we do in this procedure is we put a scope down your mouth into the stomach and can actually do this fundoplication from inside and recreate that valve on the inside without having to make any incisions. Recovery times are faster. There's no significant bloating associated with it. Patients are able to return to work almost within several days. And it has a much faster recovery. Can we go to the slides? Basically, what we do is we put a scope, as shown in the slide here, we put a scope into the mouth and down into the esophagus and then eventually into the stomach. And then from there, we go ahead and fix the point of anatomic dysfunction. There's no scarring on the abdomen. It's totally incisionless. And you can always, if for any reason, which really is not common, but if for any reason it doesn't work, you can always still do a laparoscopic Nissen fundoplication as well. The patients return to work within a week or two. And can I have the next slide, please? And the procedure itself doesn't, it requires simply an overnight stay in the hospital. It takes about 40 to 60 minutes to perform. There's minimal discomfort. And as I said earlier, most patients recover very rapidly. Okay. I have a video of the procedure, and I'd like to show that to people. Basically, this is the gastroesophageal junction. This is one that's already been created by the scope, and this is what it looks like when you're done. Prior to this, if you can imagine where that spool or omega-looking gastroesophageal junction was present, it was flat. Basically, when people have heartburn, you take this scope and you put it down the mouth and into the esophagus, as demonstrated here. The scope has the apparatus that's used to be able to do the actual surgery. The scope goes into the esophagus, and then you retroflex the scope, meaning you look upon yourself on the backside and turn it. You can turn it 360 degrees around. There's an arm on this apparatus that comes up and basically grabs the esophageal and gastric tissue and pulls it forward. And then you can put a suture through that, connecting the stomach back to the esophagus, recreating the valve that has been destroyed. Now, unlike a Nissen fundoplication, which is a 360-degree wrap, which is done surgically, this is about a 300-degree wrap. Okay? It doesn't go all the way around, but it's not necessary to do that because naturally you're not a 360-degree wrap either, which is why a lot of patients from a Nissen will have bloating, but from this procedure they won't. Okay. And so essentially now this esophagus and stomach are sutured together. You see the needle going through there and the actual plication sutures staying, and then it's done again, it's done repetitively over a 300-degree to 270-degree radius. About 16 sutures are placed. Once it's completed, you have this recreated valve, and you didn't have to have incisions or any type of seriously invasive surgery for it. The patients have immediate reduction of their heartburn and symptoms, and they're much better than they were preoperatively.
Okay, Doc, well, that was very informative, and thank you for coming and joining us on Healthwise. We hope to have you back in the future, and thank you again. And
my pleasure.
We'll see you next week on Healthwise.
Healthwise is brought to you in part by Opelousas General Health System.